first, just want to say thank you to the providers who are here today. Truly. My name is Ana Villas-Camani. I am proud to serve District 47 in the state legislature, including parts of Orlando, Winter Park, Belle Island, Edgewood. And before I was elected, I worked at Planned Parenthood Southwest and Central Florida. I had the honor of working with Dr. Sujatha Prabhakaran, who is one of the most compassionate and skilled providers you will meet in the country, alongside our colleagues with our Jacksonville Independent Clinic, with our ACOG advocates. It is a very powerful moment to have providers here today. Individuals who are targeted for their work, individuals who don't do this because it's easy, they do it because it is important. And I am so proud to stand in solidarity with them, because what you just heard today is about people, not politics. Yeah. And we have made that point time and time again, that issues around abortion access, this is not partisan. We didn't talk about the political ideology of any of these patients. When you realize you are pregnant or when you experience sexual assault, nobody should ask you what your party affiliation is. You're making a decision based upon your personal health and well-being, your doctor, medical provider, your family, your God, and not government. And just last week, we saw a Fort Myers Health Center that Planned Parenthood provides services every single day be targeted by anti-abortion extremism that is fueled by the rhetoric in this building. And so we come together today to not only be out loud and proud of our providers and to support abortion access and stand against Senate Bill 146 and House Bill 5, but also send a message of compassion, because this care is critical and essential. And we have to put ourselves in the shoes of patients who never thought they would be in this situation, some who are hoping to become pregnant, to raise a child, and others who are navigating sometimes tragic circumstances, but sometimes circumstances that are driven by not having enough money, circumstances driven by not having access to healthcare because they face systematic barriers. And unfortunately, those are the stories that get left out of this dialogue, this debate in Tallahassee. And so having our providers here is incredibly powerful and important. And I'm just here to add to the chorus that there's no such thing as a reasonable abortion ban. And for every lawmaker who tries to say that, I hope they feel shame today when they hear these stories. And they understand that, as was said in the last House committee, that a 15-week ban is not generous, which is what one of the House members said last week. You are stripping away bodily autonomy for the people in this state after you preach and parade the word freedom every single day. And you are punishing people for being poor. Because at the end of the day, abortion bans impact every single person in this state. But if you have means, you will find a way to express bodily autonomy. You will find a way to get to North Carolina, which, based on our data, would be the closest option right now for an abortion beyond 15 weeks, assuming North Carolina doesn't ban abortion too. If you have money, you'll have that access. But if you are in the experiences that were just shared today, you are going to be trapped because government told you you don't deserve to have access for some political ideology that has no consideration for the lived experiences of our constituents. And so we're fighting unapologetically against this ban and are happy to be able to see the growth of opposition across the state to this bill, because Floridians overwhelmingly, whether it was protecting the right to privacy at the ballot box back in 2012 or recent polling, have told us that they not only support the protections established under Roe v. Wade, but they oppose this issue becoming more political. And so we are not in the minority in the state of Florida. We are in the majority.